Hi, my name is Ariana Albarisi and I am presenting on COPD. COPD is a chronic inflammatory lung disease that is damaging to airways and can include but is not limited to chronic bronchitis and emphysema. The airflow limitation is usually progressive and associated with an abnormal inflammatory response of the lungs to noxious particles or gases. It is the third leading cause of death in America. COPD may not be completely reversible, but it is preventable and treatable. As an APN and an advocate for patients, I'll have the ability to lessen symptoms and improve quality of life. The prevalence of COPD is in the age groups of 40 and 45 and up. 251 million cases are presented globally. 14.8 million adults have been diagnosed with COPD, and approximately 12 million adults have yet to be diagnosed in America. The overwhelming burden of a respiratory disease does not only affect family life, school life, and work life, but economically can be a financial burden that falls upon society. Healthcare systems are paid for by tax dollars. It increases insurance rates and can result in a productivity loss. Disparities include geographical areas, availability to insurance, gender, race and ethnicity, and family income. Geographical areas, including industrialized or urban areas, are at higher risk because of air pollutants and gases. The availability to insurance means people who have higher access to private insurances are more likely to have frequent health visits and checkups, and people who have public or no insurance at all are at a higher risk due to access to health care. Males are more at risk than females for COPD, but females do have a higher mortality rate. Caucasians are more at risk for COPD than Black or African Americans or Hispanic or Latinos. And family income measured by the poverty threshold, the closer to the poverty threshold line a family is, the more at risk they can be. The ultimate goal stated by Healthy People 2020 is promote respiratory health through better prevention, detection, treatment, and education efforts. The two topics I chose to relate to COPD are how physical activity can play a role in preventing or lessening symptoms of COPD, and later on I will discuss community and education-based programs. So a study presented a group of individuals who were questioned at a beginning time period and followed throughout their lives for about 12 or 20 years or until someone had passed away. They were given a questionnaire on regular physical activity over the previous 12 months, current smoking and alcohol consumption, socioeconomic factors, current symptoms, and a diagnosis of comorbidity at the time. They were also asked how often they were to go to health services over the previous 12 months. They also had recorded lung parameters and volumes to compare to later on. What they found was that for these subjects, a level of physical activity equivalent to walking or cycling 2 hours a week or more was associated with a 30 to 40% reduction in the risk of both hospital admissions due to COPD and respiratory mortality. This is the first population-based cohort study showing that a relatively small amount of physical activity may have important beneficial effects on the course of COPD. The conclusion was that the magnitude of this effect and the fact that the type of physical activity required to achieve it can be easily recommended without the need for additional training or specialized supervision to make these findings particularly promising. The results provide evidence that future COPD guidelines should consider the recommendation that patients should be encouraged to maintain or increase their levels of regular physical activity. Education and community programs. As an APN, it will be important to have a role in the community, presenting presentations at surrounding elementary and middle schools. and coordinating learning activities that teachers can implement in the classroom. School-age children are a priority population because depending on their surrounding environments, they are still learning and adopting behaviors that can have the potential to become habitual, whether it's healthy or not. Effective programs and resources that I found are Narcan and Truth About Drugs. It's a video program. Life Skills Training, which is a classroom-based program. Linking the Interest of Family and Teachers, LIFT, is an interactive program to get families to join. Midwestern Project, ETC, and the National Cancer Institute provides NOT on tobacco, the NOT program, targeting ages 14 to 19. Important considerations when being a part of programs in the area include implementing the programs, creating policies that the schools should follow, or following up on the policies that they currently follow. What kind of education are the students getting? What kind of education are the target audience getting, and is it appropriate? And engaging families, and also offering cessation support for elders like staff and family members, and evaluating the programs. Besides prevention programs at a young age, if COPD has already taken effect into someone's life, there are many resources as an APN that I can use, especially considering the financial burden of healthcare costs. The American Lung Association provides opportunities with financial assistance programs, and the CDC also offers resources, a self-management program that is cost-effective, that is an in-person program that is about 2.5 hours a week and under $50 for registration. The American Lung Association has a program called the Better Breathers Club, which has been around for more than 40 years and has resources for quitting smoking. It also includes online support groups for people with COPD and support workplace programs and policies that reduce the risk of COPD. In conclusion, considering there are limitations to COPD being a curable disease, there is strong and accurate evidence-based practice to support that it can be prevented. By promoting well-being of patients' health and lifestyle, including physical activity, participating in education-based programs, the role of an APN can successfully make an impact for change and raise awareness throughout time. Here are my references. And thank you for watching.